Hi everyone, welcome back to my channel. My name is Rhoda and I'm a doctor working in the UK. In this video, I thought let me go through a few different tips that I would have found really useful when I started working as a doctor. As you can imagine, starting any job can be something that's really scary. I vividly remember my first few weeks being so scared, and even before starting I was feeling a bit worried about, oh, how am I going to be doing? Am I going to be able to be up to the job? And you know what, let me make a video that actually goes through really useful things that hopefully will make you feel less scared and less anxious. So let's get into it. So in the spirit of this video, I thought, you know what, let me look the part, even though I'm wearing a hoodie, so it's not quite what I want. I know this looks a little bit pretentious, to be honest, so let me take this off. Right, let me take you back a few years when I started working as a doctor. I started on the acute medical ward, and I remember coming into that ward on the first day and suddenly realizing that, oh my goodness, it's me that has the responsibility now. It's me that is going to be prescribing medications. It's me that has to kind of manage patients. Obviously the seniors and things like that, but it is so different to being a medical student. It is the steepest learning curve I've ever come across. You know, you learn so much in the first few weeks, and no amount of years at medical school quite prepares you for what you do on a day-to-day basis once you're fully qualified. So the first tip is, it's completely normal to feel inadequate, to feel out of your depth and feel as though you don't know much. And you know, you have to remember, as an F1 or a junior doctor or an intern, if you're outside the UK, you are literally at the bottom of the food chain. So you're the person who's going to know the least and is the least experienced. So that is something that is helpful to come to terms with at the beginning. So you don't feel as though you're the only person who's going through this. When you have those moments where you feel really alone, always remember that actually you're part of a team and there's always people that you can ask for help. Which brings me on to my next point, which is to ask. There is no question that is stupid enough. There's no question that is dumb or silly. As a junior doctor, you are here to learn. The only way to learn is through asking questions. If you've been asked to review a blood result and you're not really sure whether this is even significant, or you're not quite understanding what it means, always ask your seniors. If you've been asked to review a patient and you don't really know what exactly is going on, ask a senior. You know, when you're on the ward round, for example, and the consultant asks you, can you request this chest x-ray for this patient? And you don't actually know why you're requesting this chest x-ray in the first place, there is no harm in asking. And actually you'll come across as someone who's really interested and a very keen learner, and consultants will love that you're asking these questions, and they love explaining things to kind of junior doctors as well. So if in doubt, ask, even if it's as simple as you just double checking a plan that you've come up with the seniors. Always just double check and make sure that, you know, you've got the right answers. And at the end of the day, you are dealing with people's lives and you are learning as well as a trainee. So by asking, that's the real way that you actually gain more experience. And the next one is discussing with other specialities. This is the bread and butter of being a junior doctor, where you've been asked to, for example, discuss a scan result with the radiologist, or discuss a patient with a different speciality where you want them to see the patient. You know what's really striking is you don't get taught this in medical school at all, despite the fact that this is a really big part of your job. I'll tell you a little story of what happened if you do it wrong, which is what happened to me. I was on general surgery at the time, and I was asked to by my consultant to discuss an ultrasound report for a patient who came in with acute abdominal pain. They thought he might have gallstones or something. I had to speak to the radiologist. So he said to me, right, okay, what is the size of the common bile duct, which is a common finding that is reported in the scans? And I didn't know. And he was like, okay, what did the patient come in with? And I said, oh, I'm not sure. And then he said to me, so how's the patient now? And I said, I don't know. I was just following the instructions of the consultant, who said to me, go discuss the scan result with the radiologist. So that radiologist wasn't happy with me, and I think he actually hung up on me at the time, which is not what you want when you first start. What is helpful to do is, before you discuss a patient with any other speciality, make sure you know who the patient is, how old they are, what they actually came in with, what is their history, and always start the conversation with what you actually want that other speciality to be doing. So whether that's seeing the patient or reviewing the patient, that way once you've got all the information, only then do you pick up the phone and be able to answer all the questions that they want. So be prepared. So the next tip is learning how to prioritize. Let me tell you something. That first weekend I was on call. And for those who don't know what that means, on call is when you're covering the wards once the day team has gone home. So it tends to be overnight or anything after 5 o'clock. So you're covering multiple wards alongside another senior doctor. So there's literally just 2 or 3 people that are covering everything. So you are getting paged or bleeped left, right and centre by all the different nurses on those different wards, asking you to review patients, check this blood result, do a cannula, do these bloods for the patient. And those jobs can quickly start building up. So you have to learn how to figure out what is it that I need to attend to first and what are the things that I can leave for later. Because you have occasions where nurses will page you and say, you need to come quickly, there's a patient who needs a discharge letter doing because the ambulance is ready and they need to be taken to a care home, you need to come now. But then you've got another nurse paging you from cardiology ward and she's telling you there's a patient experiencing chest pain and their heart rate is very quick. So now you have to figure out what is it that I need to prioritize and where do I need to go first. And that comes with experience, figuring out what is it that you need to attend to first. And when you're on call, there are going to be a lot of jobs that you're not able to get through. There's literally not enough hours in the day. You have to be able to figure out what is urgent, what is something that can wait. No matter how much pressure you're being put under, your job at the end of the day is to prioritize according to like clinical risk. So that's the most important thing. Administrative type stuff can wait, despite what people tell you. So the next one is getting to know people that work on your ward, whether that's the nurses, the pharmacist, the ward clerk. It may sound really obvious, but there are so many advantages to getting to know people and actually making an effort to introduce yourself once you first start on the ward. Tell people who you are and to put in the effort to actually get to know people's names. Once you've eased that professional barrier between you and the nurses or you and the pharmacist, people start doing favors for you, you're becoming more friendly with each other. People will go the extra mile to make your job much easier. And sometimes when you're on calls, they may even offer you tea and snacks, which has happened. It's nothing worse than a new doctor saying like, "Oi nurse," or "You nurse, can you come here?" without really getting to know people's names. So really put in that effort to make sure that you become friendly with the nurses because they're the ones who actually know how the wards are run. They know where things are. So really putting that effort in to get to know people that work on your wards. The next one is ABCDE. Not the alphabet, but airways, breathing, circulation, disability and exposure. One of the common things that you'll be asked to do is review acutely unwell patients on the wards. And a lot of the time you may not know what is wrong with this patient and you think to yourself, oh my God, what is going on with this patient? I've been asked to review them. Oh, I don't know what to do. No matter what they come in with, whether it's a very simple pneumonia or whether they've got disseminated intravascular coagulation, you always fall back on your ABCDE. Always start off with that. Once you do that, things become much easier. You'll feel much more in control. You're doing things in a much more systematic way, and chances are you'll figure out things as you go through this list. And whether you're a junior or a senior doctor, this is what everyone does when you review an acutely unwell patient. And that brings me on to my next point, which is when I was on the wards, it was really helpful to carry a pocket-sized Oxford handbook. Really helpful when you're on night shifts, for example, and the senior doctor is not readily available. You can quickly read up on certain things. So I had this one. Look how tattered this looks. This is nearly a decade old now. I got this when I first started university during Freshers Week, and I still have it for sentimental reasons. I don't think I'm ever going to get rid of it. Yeah. Okay. So the next one is practicing things like cannulation, taking bloods, doing an ABG as much as possible. At the beginning, you're going to be pretty bad at it. I'm speaking from personal experience. I was really bad at taking bloods, putting a cannula in, always was getting it wrong. Because it's very different to practicing on a doll or, like a plastic hand or a plastic arm. When I was on the wards and a more junior doctor would come up to me and say, "Can you come and help me do this cannula because I can't get it in, or I can't take this blood, the patient's really difficult." And instead of saying, "Right, I'll do it for you," I would go with the doctor and actually observe them and guide them through doing the actual procedure themselves. The only way you're going to learn is by doing it and practicing it as much as possible. So getting people to watch you and observe you doing procedures, whether that's catheterization, whether that's doing an aseptic tap if you're on a gastroenterology ward, bloods, cannulas, that type of thing, and people can then give you pointers about your technique, and then you can start improving it over time, and then before you know it, you will be really, really good at doing this. And I'll give you a little example. On the acute medical ward, there used to be a lot of patients that needed lumbar punctures. It's a small procedure where the needle is put into the spine and then they collect fluid, the spinal fluid, to check for any infections or bleeding, that type of thing. And because literally on a daily basis we would have at least one patient that needed it, I actually learned how to do lumbar punctures, which is something to this day I'm still very proud of. The next one is taking breaks, and I cannot emphasize how important this is. When you're in a day job or you're on call, the jobs can pile up very quickly and the day can go very quickly. And you can go 6, 7, 8 hours without having sat down even once. As a doctor, unfortunately, nobody's going to tell you to have a break. There is no allocated break time. So you're the one who has to decide when that happens. And it's really, really important that you look after yourself. Make sure you're having your food, going to the toilet. It may seem really obvious, but a lot of those things people actually do neglect. And unfortunately, nobody's going to give you a medal for not having taken your breaks. Nobody's going to be like, oh my God, look at her. She's literally carried on throughout the whole 12, 13 hours without having sat down. So it's really, really important that you look after yourself and take your breaks when you need it. Last but not least is to enjoy yourself as much as possible. The funny thing is, I actually look back on my days as a newbie with a lot of fondness, even though at the beginning I absolutely hated it. But that was only because, looking back on it, that was only because I was unfamiliar with everything. I didn't know what I was doing. Everything was new pretty much. And because you feel so out of your depth, you always equate those feelings with, oh, it's because I don't like it or because I'm not good at it. No, it's only because you're not used to it and yet you're there to learn. So enjoy it as much as possible, and you know, good luck to those who are starting as a doctor in the future. Right, that's everything I've got to say today. Thank you very much for watching. If you like this video, give it a thumbs up, drop a comment down below and subscribe to the channel, and I'll see you in the next video.